The cognitive approach is different from the behavioral approach, strictly speaking here. If you're dealing with just a cognitive approach, it really teaches people to think in more adaptive ways. So immediately you can see the focus on the cognitive aspect, the thought process, and not just the behavior. A a purely cognitive approach isn't very commonly used. What's really commonly used these days, because it's very useful, it really does help for a wide variety of psychological disorders, is the cognitive behavioral approach, cognitive behavioral therapy, or just CBT, which changes the way people think using the basic principles of learning. Okay, so it combines the best aspects of the cognitive approach and the behavioral approach. For this, go ahead and go to YouTube, check out Cognitive Behavioral Therapy CBT. 2 minutes, 27 seconds. There's going to be a wide variety of things that come up. I only want you to watch this one. I can't vouch for everything that pops up. This is a very useful sort of vignette that it'll give you about kind of an example of how CBT can be helpful for an everyday kind of anxiety-inducing situation. Well, rational emotive behavior therapy is also fairly commonly used. It attempts to restructure a person's belief system. So whenever you see the word belief or thought, that's going to imply some form of cognitive or cognitive behavioral therapy. So this attempts to restructure a person's belief system into a more realistic, rational, and logical set of views. So it's all about trying to get people to think more rationally and less emotionally. Okay, that's basically the general cognitive behavioral approach. So you can talk about the ABCs of CBT, okay, the ABCs of cognitive behavioral therapy or of rational emotive behavior therapy, which are similar. So you have an activating event, a triggering event of some kind, which also includes the client's or patient's immediate interpretation of the event. Then you have the B part here, beliefs. Okay, their evaluations, whether they be rational or irrational for that event. And that YouTube video I just pointed out before will give you a good example of this. And finally, consequences. Okay, the emotions, behaviors, and other thoughts that come about based on these beliefs and ultimately from the activating event. Okay. Okay, well, in the next segment, I'll get into humanistic, interpersonal, and group approaches to treatment.